Welcome to the Global Green Action Project, where we get to meet amazing heroes doing great change in this world to make it a more compassionate and better place through humanitarian, animal, and environmental initiatives. I'm your host, Jennifer. And now we're going to meet an extraordinary doctor as our next speaker, who has made it his mission to help other healthcare professionals around the globe and frontline support workers. Let's now introduce you to Dr. Hamid Elmyar. I'm so excited to have you here today. Doctor, how are you doing?
Good, great. Thank you, Jennifer, for having me on here, and really happy to be here and chat with you.
I'm looking forward to hearing your experience. You've met so many people. You're working in the trenches. You've seen the befores. You're seeing the experiences in the moment. You're seeing the projection into what we might see in the healthcare system in the future. I'm really looking forward to hearing what you have to say in terms of how we can support our healthcare providers and our caregivers, their families, their children during all this change that's going on, and hearing your advice on how we can cope and better manage with stress and anxiety and all those things. Yeah.
Absolutely, I would be happy to. And let me begin with the definition of health by WHO. Actually, health is not merely the absence of disease. It is physical, mental, and social well-being. So when we say, if we see health as a triangle, and you see the social, mental, and physical part of it, that those three parts are really interconnected. And as a health practitioner myself, being a physician and then also focusing on community health and community development and public health, I see perhaps the importance of this definition more than probably others who are not just focusing on clinical work. Not to underestimate their work, but this is when you see it from different perspective, outside of the textbook, outside of the clinical settings, then you realize that health is really that triangle. And with that, I also believe that health is not limited to private practices and hospitals. It has to start from every individual, communities, schools, businesses. And for that to happen, we have to have that upstream approach to health. And especially during this pandemic, and a lot of challenges for people, both in the healthcare industry and in general in people's lives. It's unprecedented situation, and puts a lot of people's lives in a difficult situation. So with that being said, of course, the stress, as you just mentioned, is one of the things that is exacerbating people's health issues, and that is a challenge. But I would be happy to, if you have more questions, to go deeper into that also. But before that, I just wanted to mention that and acknowledge the tremendous job that all healthcare providers are providing during this tough situation, and all frontliners who are working around the clock to make sure that the rest of people are, safe and healthy. And of course, yourself, who is focusing also, playing your important role in that. You recently published a book, and congratulations, about stress in kids, and that's very important, especially for healthcare providers who go and work in the hospitals or at their private practices or at the health facilities. Their kids are most of the time away from their parents. That definitely will help, and I appreciate that.
Thank you so much for those kind words. It's in community, right? When
Right.
it makes all the world a difference. Yeah.
Absolutely.
I'm curious about, maybe we can talk to a little bit about the history of how you came to be where you are today, because it's not a common path. Many medical a medical professional, sort of in two different realms is what I'm trying to say. So how did
Right.
you merge the two? How did you get to that sort of process?
That's a very good question, Jennifer. And thank you for asking that. It reminds me of my why. And I always, ask I also host a podcast. I ask my guests, who are mostly physicians, about their why. And as we all heard from Simon Sinek in his book, Why, and when he explains that, of course, if you know your why, then the road is very clear, and your goal is clear, and the destination is more visible to you, where you're going and what is your goal in life and why you want to do what you want to do. And my why was always, trying to help people. When I was even back in high school, I was thinking about ways to help people. And for that to happen, I decided that I wanted to go to medical school because, being a physician, you can be more helpful. Of course, all other professions can help people, but you're directly involved actually in people's lives, and health matter. Then I became I graduated from medical school successfully, and then being a general practitioner, I just asked myself, am I ready now to help people? And that was the time that I was thinking maybe I should do a specialization. I'm not actually ready the way I should be able to help people. So I did a residency in pediatrics. And so I had to go another specialization in order to be more specific in what am I doing, because children and women, unfortunately, are the two most vulnerable members of the society, both in developing and developed countries. So I wanted to focus in there, and that was the moment, the third year of my residency in pediatrics, and the that I realized that um, unfortunately one of the shifts that I was there on duty and on call, a 6-year-old girl, her parents brought her from a remote area, and I'm talking about the developing countries, where they were on the way for 3 days. By the time they were at the hospital, unfortunately, this little poor kid was in what we call irreversible shock. So you can't really do much at that level. And then I was together with the team, was trying to help her. She was, heart failure, renal failure, and shock and coma and everything. So that we unfortunately we couldn't save her life. That was the moment that was really shocking to me and shocking to the team. And I asked myself for the second time, am I really helping people? Is this the way that I wanted always to help people? Why are these people getting sick in the first place? And when I looked for the underlying cause, and the underlying cause, which was really more shocking, was that little child actually came in that critical condition due to diarrhea. And diarrhea is, in very easily preventable. But if it's not, if people don't have that little basic health education, then it leads to dehydration, it leads to renal failure, heart failure, and all that, shock and consequences of that. So I asked myself, like, why all these people getting sick in the first place? What are some of the root causes for these health issues, and what can we do to, you know, help people to not get sick in the first place? And that was a shift, as you were asking that how I switched that. That was a dynamic, like I would say, a paradigm shift in my career, in my work, in my life, that I decided to approach the upstream approach to health, and look for the underlying cause. And I pursued my master's in public health and focused on community health education. Rather than just sitting at my private practice or hospital, I wanted to reach at a population level. And I believe that health practitioners are made to impact millions of people, not only just their private practice or hospital. with that goal and mission in my life, I still do what I do, and that's my why. I also bring healthcare practitioners from across the world in all walks of health and specialties around the same table to talk about health issues and find a solution, and that upstream approach, which could be a comprehensive one to, at the end of the day, make sure that our patients, our clients, so in general, the people in public are healthy and safe and have a better life.
Awesome. That's what comes to mind. And I think that's fantastic. I'm really honored that you're here. You have so much to share, and your why is so needed. I mean, we just want to be supporting you on your mission. Thank you for
Thank
sharing
you.
that.
Appreciate it.
With that said, the whole podcast thing. So can you speak to that a little bit more in terms of how that evolved? Because obviously we can kind of start to see how that plays a part in your mission.
Right.
I'm curious about how that evolved. Yeah.
Thank you so much. This is, again, a very great question. And I started my podcast in the wake of COVID-19. The reason I started that, again, when I heard, unfortunately, a lot of physicians across the world lost their lives in saving their patients' lives during this pandemic. And I knew personally a few of these doctors who were amazing doctors, unfortunately died while treating patients at their hospitals or private practices across the world. And so I was looking for ways, again, that my mission in life to help people, and being a health practitioner myself, like why these health practitioners and physicians losing their life who could impact millions of people. And we need them more than ever now, more than ever during this pandemic. So I was looking for ways to help people, to these physicians and healthcare practitioners in general. Then I decided to start my podcast. And I started a podcast. I invited physicians who are, experiencing firsthand the situation during this pandemic at their hospital or, private practices. And I had so far physicians from the US to Germany to Australia to Thailand to from different countries across the world, and including those physicians who were, for example, Dr. Tyler, who is the #1 physician responsible for controlling coronavirus and COVID-19 in New York City, was on my show. He is actually, as we all know, that New York was the epicenter, not only here in the US, but across the world. Unfortunately, now it's better. But so, these people with their amazing job that they do, and other health practitioners from clinical psychology to public health to naturopathic to functional medicine to specialists like in infectious diseases, all of these amazing people, I brought them on the show to share their experience, knowledge, and insight with the rest of the world and here in the US, so that other physicians can learn from the experiences. Because as we all know, this pandemic and coronavirus, the novel coronavirus, was new, and a lot of things were unknown for even healthcare providers. And that's how I started my podcast, to share that knowledge with the rest of the world. I also have a background in teaching. When I was in junior high school, I learned English, which is not my native language. I learned it, as they say, the hard way. I had to go through all those courses and take extra classes and learn the language. And then I became an ESL teacher. And then I started, when I graduated medical school, I became a faculty at the university to teach pediatrics for other students. Being a teacher, I always, I always say that teaching is learning for the second time with more details.
Uh-huh.
And you being yourself a teacher, when you teach something, you learn it for the second time, but this time deeper and more profound, because you have to be, able to explain it to others. And podcasts, I say, through the same lens type of thing. When I started podcasting, the journey that you asked, is that, of course, you have to prepare with the technical things and everything, and you have to make sure that the timing and the schedule. And I have a full-time job plus some other commitments with nonprofits that I work. I have consultations, and I also do something online. And beside that, on my days off, I do my podcasting. And so apart from those challenges, it's a great learning experience for myself. And to all these amazing people that I've mentioned, and I can't mention all of them because it's a long list. And I learned from all of them. I learned from what's happening in the world. I learned about what's the health challenges here in the U.S. And how we can all get together to make a huge impact in people's lives. At the end of the day, as I said, our goal is to help people and to make sure that people are healthy and safe.
Well said. Well said.